Good morning, everyone. In the field of health and biological sciences, understanding disease is fundamental to promoting well-being, advancing medical knowledge. Diseases have affected human population throughout the history. So, studying the nature, causes of disease is essential for developing various strategies, various preventive measures, and treatment which are useful for public health policies. So, it is my pleasure to introduce a group of dedicated students who will be sharing their knowledge on the important topic of disease. Their presentations will not help only in better understanding how diseases affect human body, but also highlight the significance of public awareness and health living. So, here we continue.
Good morning, everyone. Today, I am going to talk about a very common but dangerous disease known as malaria. It is a disease that affects millions of people every year, especially in tropical and subtropical regions. Although it can be prevented and treated, malaria still remains one of the world's major health problems. Let's start by understanding what malaria actually is. Isn't it true, Parav?
Yes. Now I'm going to explain what is malaria. Malaria is a disease caused by a tiny parasite called Plasmodium. This parasite is spread to humans through the bite of an infected female Anopheles mosquito. When the mosquito bites a person, the parasite enters the body through the main bloodstream and travels to the liver, where it grows and multiplies. After some time, it affects the red blood cell, causing symptoms of the disease. Now let's look at the symptoms of malaria. Ujjwal, can you tell us the symptoms of malaria?
Yeah, sure. The symptoms do not appear as soon as someone is bitten. They usually start after 10 to 15 days. The main symptoms include high fever, chills, shivering, sweating, headache, muscle pain, nausea, vomiting, weakness, and tiredness. In several cases, malaria can cause anemia, damage to vital organs, or even unconsciousness. In children and pregnant women, it can be very life threatening. Here are some important preventive measures. Do not allow water to accumulate around your house as mosquitoes breed in still water. Use mosquito nets while sleeping, especially at night. Apply mosquito repellents and use coils or vaporizers. Wear full sleeved clothes to avoid mosquito bites. Keep our surroundings clean and insecticides in water tanks or drains. In malaria prone areas, take preventive medicines as prescribed by the doctor.
If we take all these preventive steps seriously, we can greatly reduce the effect of malaria and save many lives. To conclude, malaria is a preventable and treatable disease, yet it is continues to affect a lot of people during the awareness and by maintaining cleanliness, preventing mosquito breeding, timely taken treatment, and supporting vaccination program. We can defeat malaria. Remember, every small effort counts in making healthier and world malaria free.
And the name of our disease is influenza. Causative agent of influenza. Influenza is caused by a virus known as influenza virus. It mainly attacks the respiratory system that includes nose, throat, and the lungs. Types of influenza virus. There are 4 types of influenza virus: influenza A, B, C, and D. Influenza A. It infects both humans and animals and can cause major outbreaks and pandemics. Influenza B. It only infects humans and can cause seasonal flu. It is milder than influenza A. Influenza C. It infects humans, cause mild cold-like illness. No epidemics means no infection. Influenza D. It is only present in cattle and does not affect humans. Over to Dronika.
Mode of transmission. Airborne droplets spread through tiny droplets when an infected person coughs, sneezes, or talks. Direct contact. Touching an infected person's hand or face. Indirect contact. Touching contaminated surfaces or objects like doorknobs or phones and then touching the nose or mouth. Close contact. Being near an infected person. Short summary. Influenza spreads mainly through airborne droplets, direct or indirect contact, and close contact with infected people, especially in crowded or enclosed areas. Over to Divyani.
Symptoms. Symptoms are fever, cough and sore throat, runny and stuffy nose, headache and muscle pain. Diagnosis: physical examination. Doctor checks symptoms like fever, cough, sore throat, and body ache. Rapid influenza diagnosis test RIDT directs influenza viral antigens in a few minutes using a nasal or a throat swab.
Prevention of influenza virus. Vaccination. Get the annual flu vaccine. It is the best protection against influenza. Second, good hygiene habits. Wash hands regularly with soap and water. Use tissues or elbows when the contagious disease affects the respiratory system. It can be prevented with good hygiene, vaccination, and a healthy lifestyle. Early care and awareness help protect ourselves and others from the flu. Thank you.
Hey everyone, today Nitin Yadav is here to explain a bacterial-borne disease that is cholera. Cholera is a bacterial infection caused by the bacteria Vibrio cholera, and it is spread through contaminated water and contaminated food. Here are its causative agents, symptoms, preventions, and diagnosis. Causative agent. It is caused by the bacteria that is Vibrio cholera. It is a gram-negative, comma-shaped bacteria. Symptoms. Its symptoms are severe watery diarrhea, vomiting, extreme thirst, fatigue, muscle cramps, dizziness, rapid heart rate, and dehydration. Diagnosis. Various tests such as serology and stool culture tests should be done to detect it. Second, clinical evaluation of symptoms should be done while we are moving in an area which is prone to disease cholera. Prevention. Drink safe water. Practice good hygiene. Eat well cooked food and avoid seafood. Consider vaccination Vaxchora while we are moving in an area which is most prone to cholera. Treatment typically involves rehydration therapy and antibodies to reduce symptoms and prevent spread. Thank you so much.